To kick off this afternoon session, I wanted to recognise and honour the decades of consumer activism that has fought for voice, choice and rights and really impacting the landscape we work in today. This movement continues to challenge systemic harms and inequalities, and we recognise the leadership of people with lived and living experience, the contributions of consumers, families, carers and supporters in informing policy, practice and governance. We affirm the diversity within the lived experience workforce and acknowledge intersecting impacts of culture, identity, ability and life circumstances. We also value the wisdom in the multicultural communities across the country whose perspectives enrich our understanding of care, connection and healing in new and different ways. Our work today, grounded in this forum, draws on the wisdom and passion of those who came before. We honour frameworks such as intentional peer support and other dialogical network and holistic approaches to relational care. We stand in solidarity with First Nations people and their fight for self-determination, recognising that mental health and AOD systems must uphold cultural knowledge and sovereignty. First Nations perspectives, such as social and emotional well-being, continue to humble and remind us that our work is part of much larger, longer and deeper traditions of care, resistance and community. Yeah. Now, just before I get into what is integration, I'm not used to having power like this and a microphone, so I just wanted to offer a couple of reflections from the morning. Emma, when you were reflecting about Colin's talk around how the Lived Experience Network kind of seemed more connected, and I know that there have been a lot of kind of things that have been funded through the department, but it also didn't surprise me at all, given that one of our key principles is solidarity, and I just naturally, like we're often referred to as like a rhizomic network, and I think solidarity, is inherent in the work we do and collaboration, and I kind of think that lived experience kind of trumps orgs, if you know what I mean, as in we connect across our values rather than across organisations. So yeah, that really stood out to me. I also was struck by the epistemic injustice in the wider system, not just kind of, located in peer and clinical or AOD, but also the smaller orgs that are interacting with the larger orgs and how their way of knowing is potentially not as valued. And then, it struck me that we need more relational commissioning. And, when someone was saying that they had to carve out a reflective practice space out of their team meetings, like we really shouldn't have to do this. This should be prioritised and funded as part of the work. So, what do we actually mean by integration? Now, across all the talks so far, we've really heard a consistent thread that integration, collaboration, partnership, whatever language we use, ultimately comes down to relationships. And relationships are hard work and messy. We all have different worldviews on what this work should look like, and those worldviews influence how we design, fund, lead, deliver, and evaluate services. People, roles, and services from marginalised communities or non-dominant worldviews face extra barriers in the system that were not built for them and can, at times, feel actively unwelcoming. Because it's hard, the relational work of navigating difference often gets avoided, minimised, or devalued, and the status quo is maintained. So, again, what do we mean by integration? We've had a 30-year policy focus on dual diagnosis, from the capacity building era of the 90s to the reforms we're in right now. And despite all the history, integration still feels difficult in practice. People describe navigating fragmented systems, duplicated assessments, conflicting expectations, and services and staff that don't collaborate. So, there is no single agreed definition of integration, yet it is mentioned approximately 86 times throughout the Royal Commission, And the Commission uses integration to describe system-wide service level and cross-sectorial reforms, not just integration for AOD and mental health. There is a long list of where integration is expected: integrated care, integrated governance, integrated workforce models, integrated digital systems, and integrated pathways across sectors. So I guess if we took a narrow view, we could say that integration means we share a building, shared paperwork, one referral pathway. A broad view is integration means a shared purpose, shared accountability, and shared power, and working together without losing our identity, culture, or the expertise that each workforce brings. And that's the core tension. Too much integration and we lose diversity and innovation. Too little and we end up with silos and fragmentation. So, earlier in our talk, we mentioned that we were going to ask workshop participants to map what was in their control and what belonged to the wider system. And I was really thinking around Windana's talk around reducing the rhetoric to reality. I feel like we can look at the told stories as kind of the rhetoric, and the untold stories as the reality. Earlier in our talk, we mentioned that we asked workshop participants to map what was in their control and what belonged to the wider system. People felt the wider system was something far above them, something they could feel, be impacted by, but not necessarily shift. In this room, it's a little different. Many of you hold influence over the very structures and pressures that people named. This gives us a different starting point and a different responsibility. So as we move into this next part, we want to look honestly at what integration means from your part of the system and spend time on what sits below the water, the tensions, the hopes, the fears, and the pressures that impact how we actually work together. So in the spirit of parallel practice, as Pete mentioned, I want to bring us back to a technique that we used in our workshops that we presented on earlier. And so this is the code of care. So we'd like to bring the same care and intention into this afternoon session. This is just a call to action to remind us that we are all responsible for creating safe enough spaces to share, connect, and learn together. Listening differently, noticing discomfort when it arises, being mindful of our impact, practicing kindness and generosity, reflecting on our own worldviews and our part. Katie, I was thinking a lot about the mirror. Stepping up and stepping back just means if you're someone who's quick to talk, we would love you to make space for some of the quieter voices. And of course, try and speak from I, and be thoughtful in how you're forming your thoughts. Psychological safety means relational accountability, your part and mine. All right,